What is asthma? Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to breathing difficulties, wheezing, coughing, chest tightness, and shortness of breath. It's a highly prevalent disease affecting people of all ages and races, and is estimated about 300 million people are globally affected by asthma. Asthma is caused by a combination of genetic and environmental factors. People with the family history of asthma, allergies, or atopic conditions such as eczema are more likely to develop asthma. Environmental factors such as air pollution, tobacco smoke, and respiratory infections can also increase the risk of developing asthma. The symptom of asthma can vary from person to person and can range from mild to severe. Common symptoms include wheezing, coughing, chest tightness, shortness of breath, and difficulty breathing, especially during physical activities. Asthma attacks can be triggered by a variety of factors such as allergens, exercise, stress, air pollution, and viral infections. Diagnosis of asthma is basically on the through medical history, physical examination, and lung functions test. These tests can help to determine the severity of diseases and can develop an effective treatment plan. The treatment of asthma aims to control inflammation and narrow airways, prevent symptoms, and reduce the frequency and severity of asthma attacks. Medications are the mainstay of treatment and are typically delivered using an inhaler or nebulizer. Inhaled corticosteroids are most effective medication for controlling inflammation, and other medications such as bronchodilators can help open up airways and relieve symptoms. In addition to medical treatment, lifestyle medications can also help to manage the asthma symptoms and prevent attacks. People with asthma should avoid triggers such as tobacco smoke, air pollution, and allergens, and maintain a healthy lifestyle, including regular exercise and balanced diet. Additionally, people with asthma should have written asthma action plan which outlines what to do in case of asthma attack and how to manage their symptoms effectively. Treatment of asthma. The treatment of asthma aims to control inflammation, prevent symptoms, and reduce the frequency and severity of the asthma attacks. The mainstay of treatment is medication, which can be delivered using an inhaler or nebulizers. Following are the common types of medication used to treat asthma. Inhaled corticosteroids, the most effective medication of controlling inflammation in airways. Bronchodilators, medication that help open up airways and relieve symptoms. They can be used as a quick relief medication during an asthma attack or as long as term maintenance of medication. Leukotriene modifiers, modification that target the inflammation causing chemical in airways. Theophylline, a long-acting bronchodilator that can help control symptoms. Immunotherapy, a type of treatment of people with severe allergies that can trigger asthma symptoms. It involves gradually exposing the person to increasing amount of allergen to build up immunity. Some brand name of inhalers. Metered dose inhalers contain a pressurized canister of medication that is released as fine mist when the person inhales. Dry powder inhalers contain a powder form of medication that is inhaled into the lungs. Soft mist inhalers deliver a fine mist of medication into the lungs. The medication delivered by inhaler works by reducing inflammation in airways, relaxing the muscle around the airways, and opening up airways to improve breathing. This helps relieve symptoms such as wheezing, coughing, chest tightness, and shortness of breath, and prevents the asthma attacks. Inhalers are also effective and convenient way to deliver medication directly to lungs. They're also oral medication and have fewer side effects. However, proper techniques is important to ensure that the medication is delivered effectively to the lungs. People with asthma should work with their healthcare provider to learn the correct techniques of using the inhalers. Some leukotrienes and their brand names. Montelukast, Similar are oral medication that blocks the action of leukotrienes. Cephalocasts are also oral modification that blocks the action of leukotrienes.